So I'm thrilled to be here, and such moving speeches so far. So schools are being fed two deeply concerning messages about how best to support pupils and students who are in emotional pain. One is the disorder message. Lots of courses for mental health leads, which are spot the symptom and the disorder and refer on. And, you know, we're trying to bring them up to date with what's happening and the power threat meaning framework, because they're way out of date, and it's tragic to see this. So I'm going to be, don't think you have to read all this, because I'm going to talk through each chunk in time. So this first model, the disorder model of human distress, which is still very much in schools. I have a broken brain, this person is bipolar, ADHD, ASD are absolute rife for so many children. 2 out of 3 teachers feel that if they talk to a child who self-harms, they're going to make things worse. That is how awful it is in terms of hearing people's stories. We fail our children if we only see symptoms and behavior without addressing their emotional pain. And how beautifully Deborah was talking about language. We need a language for emotional pain rather than these interchangeable words like mental health and mental ill health. We're talking about pain. Let's talk about pain. And as you will see, children and students do talk about pain. It's just that many teachers don't. When a child or teenager is given a diagnosis, people stop thinking and they stop listening, and use Deborah's language, they stop being curious. These are posters that we have, many posters that you can get. This is one of them. I'm using lots today. Spot the symptom and refer on. To whom? Between 2020 and 2021, there were over 500,000 referrals to CAMHS. Less than 1/3 of those in distress were able to benefit from support. And many teenagers take their own lives whilst they're on a CAMHS waiting list. So the second model that is dysfunctional in school is PSHE. And this is personal social health education, and it is all about let's help you get into your happy zone. I'm not exaggerating. Sam is sad all the time. How can we help Sam move from his struggling place to his well-being place? And in the HM Government Wellbeing for Education Return COVID-19 initiative, there were over 40 references to resilience. Our children and pupils are saying, I don't feel at all resilient. And this was, a partnership with the Anna Freud Center. So this thing about let's do some mindfulness, or let's all be resilient, is just really shitting on people's emotional pain. Another of our posters. Unprocessed trauma. Trying to manage your pain with things like positive thinking, exercise, mindfulness, listening to music is a bit like using a bucket to stop a tsunami, because at the end of your mindfulness, you will still have your body hatred, your panic attacks, your self-blame, your blocked trust, and using sex, for example, to seek attachment. They're still there because the emotional pain has just been whitewashed. Trauma-informed schools, we've trained over 20,000 staff, and in doing so, we are repeatedly told that pupils and students can't relate to the patronizing PSHE curriculum. So they find it boring because it doesn't speak to them about their emotional pain. This leaves so many of them desperate to talk to someone about their painful life experiences, and who is listening. They want to make sense of what's happened to them, not have their feelings managed or be told they have a mental health disorder. Beautifully put by Guy Claxton, the yawning gulf between lessons and life. These young people sitting in our classrooms, their heads are full with ideas much more complex than solving a maths problem. And yet so many schools that are not trauma-informed do not embrace home life, and how home life, unless we listen to it, will absolutely derail learning and sometimes bring about behaviors that challenge. This is with a poster with Lucy's permission. Supporters of the psychiatric diagnosis approach are quick to say, but we don't have any valid alternatives. This simply is not true. The alternative is to hear people's stories. So in our view, what we need to do is the model, the middle, as you see here, which is not in trauma, in schools that aren't trauma informed, it's not there. It's a pupil student led model. It's about listening to their stories. It's about ensuring that all teachers are trained in empathic attunement and active listening. They still know limits of competence. They still know when they need to refer on. But so much can be done by listening and understanding. And we have all the neuroscience now that being listened to, being understood, dramatically impacts biochemistry. And, you know, soothes and brings about good vagal tone in the body and brings about these wonderful opioids in the brain, which, you know, psychiatric drugs just can't get to. And that's the power of healing through human relationship. So just to make the point about how profoundly in touch with emotional pain students and pupils are, I'm going to show you a short film. We're on every school in Cornwall. And this is just one school, just 2 classes of 11-year-olds and 13-year-olds. And they were asked, I wish my teacher knew. And this is what they said. It's not about asking staff to be quasi-psychotherapists. It's about replicating in schools what happens in best parenting. good listening, mental state talk, affect labeling, helping children and teenagers to make sense of what's happened. I was at a conference recently, and a very well-known school counselling organisation said, we see 23,000 children in the UK. There are over 1 million children in the UK who have what's known as a mental health issue, I would say emotional pain. And Lord Layard stood up and said to this woman, Madam, we need an army. 23,000 children is a drop in the ocean, and that's why we have to support teachers to be listeners. And there is evidence that appropriately trained and supported staff, such as teachers and school nurses and teaching assistants, can indeed, being emotionally available to their students, can achieve results the same as trained therapists for mild and moderate mental health problems. Because one emotionally available adult before the age of 18, we have all the evidence with the ACE studies that this is called social buffering, can interrupt that trajectory from painful life experience and trauma to long-term physical health, ill health, and early death. All staff need to be trauma informed and be able to offer active listening. And this is happening, we are delighted to say, in Sheffield Hallam University, who's in partnership with us, who are absolutely training all their teachers in this way. Let's look further now at the damage we do if we give a child a psychiatric diagnosis without ever asking, what happened to you? Sally, age 11, was diagnosed with ADHD and put on Ritalin. No one had ever asked her what it felt like when her parents split up after she witnessed marital conflict for years. She went to the Maudsley Hospital, was given behaviour modification. It didn't work because the trauma wasn't being addressed. The relationship with her mother got worse. She was put in residential care. And this is how profoundly eloquent she was. She could have absolutely talked about her trauma. She said, I shall die now, because by sending me away, Mummy, I have only half my heart. The other half is with you. And she, when I last heard, the relationship with her mother never got repaired, and she's in long-term residential care. No one helped her with her trauma. It is emotional neglect. A different girl, Emma, I worked with, same kind of background, diagnosed with ADHD. Would you help me understand what it was like for you when your mum and dad argued? We work with sound play, with imageries, with emotion cards to help children talk. And this is what Emma said. There were volcanoes in the kitchen, and she picked the shock card from our cards. And so what we're doing with the arts is really helping process trauma. And of course, when Emma had processed her trauma, the ADHD type symptoms completely disappeared. So the language of mental illness, the child has ADHD, put her on Ritalin to manage her behavior. The language of trauma, the child becomes hyperactive and hypervigilant to deal with the terrifying chaos of her inner world. Another girl, Ella, diagnosed as ASD, autism spectrum disorder, poor eye contact, hypersensitive to noise, odd shaking movements with her hands, eating problems, hyper anxious. Someone just slapped this label on her. And yet when she was with her aunt, all the symptoms disappeared because her aunt was lovely. This means the diagnosis is entirely inaccurate. If you have a neurological compromise, you have a neurological compromise. You can't turn it on and off. Both her parents had a high ACE score. Neither had ever sought counselling or therapy. No one had ever listened to Ella to talk about what it was like to live at home. I went to a conference, and the head of the autism service stood up and said, would you please stop all these schools in Cornwall sending all these children to us who clearly are not on the spectrum? When we ask their parents what's happened to them, it's obviously trauma. This woman was desperate. And just one more. This was a case I saw. Billy, age 13, watched horrific domestic violence For he'd been given a label ASD. No one had ever heard his story. So he was in hell for 8 years. And he had fighty movements and, obsessions with war. And so people thought he was odd. Let's give him an ASD label. 8 years is a long time to wait to hear someone's story. The tragedy is that for many children, their story is never heard and the diagnosis remains. And this is one of his first images. Yes, he was all sorts of fighting and attacking, and yet gradually he began to trust me. And in one session, if you look at the little tower at the back, he said, my heart is underneath that tower. And when the enemy go far enough out, then my heart can come out and beautiful things grow from it. And I said, but Billy, the enemy never did go far enough back, did he? Because your dad was always in the room hurting your mum. And he burst into tears and said, I've got to draw the broken teeth. And proceeded to do just that for several weeks, about how broken he felt. His heart was broken. His mummy was broken. His family was broken. And at the end of my work with him, I said, would you just like to do a sand play of anything? He had a cold at the time, and he said, this is the sand play of the blocked nose, but help is getting through. And I think this was me in the ambulance. And he knew all his so-called ASD symptoms totally disappeared. There we go, another of our posters. How long do we leave a teenager with a confused, untold story like Billy, who'd had to wait 8 years, a day, a year, a whole school career? Psychiatric diagnosis and medication don't heal children. We have a tsunami of research on psychology and neuroscience about what does heal children and help them recover from trauma. So what are we doing just giving out diagnosis and medication? It is tantamount to emotional neglect. So we know from the ACE studies that we leave a child with an untold story, just whack them with medication and diagnosis. They'll have such a high chance of early death and midlife suffering from any of these. We know that chronic stress from untold stories turns off. We have tumor suppressant genes that stop us getting cancer. They're turned off. And we now understand, as Nadine Burke-Harris says, how to interrupt the progression from early adversity to long-term mental anguish, stress-related physical illness and early death. And this is all the research on protective factors. And as I said, all the neuroscience of what feeling understood does what being listened to. And we know even now that that when someone is heard and listened to and tells their story, it actually activates reward centers in the brain. So every child with an ACE needs, adverse childhood experience, needs a night. And that is what we do. We train as many school staff as possible to be emotionally available adults. And there is the research that just one before the age of 18, and then, of course, after that, can make all the difference in terms of prevention. And in terms of activating brain chemical systems, I was very fortunate to study with Jaak Panskep. As he says, prescription drugs will always be a blunt instrument compared with the subtle symphony of lovely human interactions, which we know will optimally activate in the brain opioids and dopamine and serotonin from a hug, not from a medication that we know, like methylphenidate, we don't know about the long-term damage, but we know in animals who were given methylphenidate, they all got early Parkinson's. And we haven't got there yet with the Ritalin generation with children. But we know from Panskep's work that attachment play is as effective as Ritalin. And what are we doing not giving children who are agitated both hearing their story and attachment play? But some people say, but shouldn't schools just be about learning, not healing? Amanda Spielman, head of Ofsted, and I've got this quote because I don't want to be sued exactly. And she said this: I think it is important that schools are schools and don't try and turn themselves into therapeutic institutions as well. A clear division of responsibilities will always have to be there. And I would like to say to Amanda, how do you sleep at night, knowing about all the preventable deaths? And when I walk past a homeless person on the streets, I immediately think, that is a person who tragically the school did not give an emotionally available adult. The school system has failed that. Schools have to be pathway to public health and pick up that baton, and boy, they can. We have trained so many people who are breathtakingly, beautifully emotionally available adult. This is a work-based learning program. They do it, and in day 10 they show their cases, and my goodness, you know, they have become a child's emotionally available adult. Just to quote one, you know, recently, a teenager who suffered from anxiety. She had only attended school 2% of the time, and with this emotionally available adult, her attendance rate went up to 98% because someone was there for her. So how do you sleep at night, Amanda, knowing about the preventable deaths? I'm just going to finish with one slide. This is James Doherty. We have a board of advisors who have all had lived experience. James can remember behavior modification in his school when he, Mark, Brian, and Eric were all put on the blue square for bad behavior. None of them were given an emotionally available adult at school. When James left school, after years of suffering and a heavy addiction to alcohol and engaging in violence, he then did get an emotionally available adult. He now does amazing work in ACE awareness and violence reduction. Mark, Brian, and Eric never did get an emotionally available adult, either at school or later in life. They are all dead now, midlife. Thank you for listening.